Hi, everyone. Thank you for having me here. My name is Moria Byrne-Zaaloff. I'm from Bronx Health Reach. I'm the program manager of the flu and COVID and other adult vaccine program. I also have somebody here. I think he's on in the audience, Felix Rojas. Did he jump
Not yet.
in? Not yet.
Not
Okay.
yet.
Okay.
And I don't
Um,
see your screen yet.
you don't see my screen?
No.
Okay. Do you see it now?
Yeah, there it is.
Okay. Okay, great. All right. Um, so I am here to talk about COVID, flu, and other vaccines, and prepare you to talk about vaccines with your community members. I've been doing this for about vaccine education for about 4 years. And our campaign has really grown. We've reached over 10,000 people or vaccinated over 10,000 people and reached thousands and thousands of people through our education and handouts, what have you. Um, the campaign is an effort to increase the number of people getting the flu, COVID, and other adult vaccines in the Bronx. And that campaign is part of an initiative of Bronx Health Reach, which works to eliminate racial and ethnic health disparities in African American Latino communities in the Bronx. So today we're going to talk about a few things: the impact of COVID, flu, and RSV in the US, in defense of COVID, flu, and RSV treatment, and then in defense of other adult vaccines. So, and as I'm talking about this, I'm going to weave into the conversation, how do you address this in a trauma-informed, culturally responsive way? So I will say that we tend to not talk about a lot of data. We found that, depending on people's um, education level, interests, data does not seem to hit people as something really important, but it's important for you to know as for your background that, and we keep things in very simple terms. What I normally say about what's happening with COVID is that I show data, but I talk in terms of not so much the numbers, but that it's climbing, that it's increasing, that we're seeing higher numbers than we've seen in 2 years. I don't really dwell on the percentages and that sort of thing. So, but it is 13%. We're at 13%, which is COVID rates have been climbing higher than they have since 2022. Bronx is seeing a rise in infections this fall. It started to rise in July, which was surprising because we really haven't seen numbers like that in a couple of years.
Would
Um,
you say that the cases are more severe?
we don't really know. We don't really know. I guess the only way we know is hospitalization rates. And sorry, hold on. Can you shut my door, please? Thank you. Sorry, I forgot to shut it. Um, the Based on hospitalization rates, the hospitalization rates are not that high. So I would say it isn't severe, but it's something we need to keep an eye on. That's the main point. Um, and like anything else, we don't want um, the rates to get so out of hand that it's too late to do anything about it, which is kind of what happened in the beginning, right? We really didn't know what it was. We didn't have any information about the virus. And so we kind of sat and waited to see what would happen. And that's where we got into trouble. But that was because we really didn't know anything about what COVID would do and how it would affect people. Now we know, right? So now the idea is, okay, we'll watch patiently, but if the numbers rise, we start to take precautions. So now health centers are again wearing masks. They're encouraging people to vaccinate as the numbers rise. And then we watch to see what happens. Will it get so severe that we need to ask people to stay home? Right now, um, if you are infected, you just, and you're vaccinated, you're updating your vaccinations, you probably only, and you're not having symptoms, you probably only have to wait, I think, 24 hours. If you're symptomatic, then you have to wait a couple of days until you test negative. to to um, to stop quarantining. So that's kind of, it's a wait and see pattern, right? Um, does that is that helpful?
Yeah, thank you.
Okay, great. Okay, so why is this important? Why are we still watching COVID, flu, and RSV rates? Well, nearly half of Bronx residents have reported a chronic illness. That's 43%. What that means is that people who have heart disease, diabetes, obesity, they're more vulnerable to illness and becoming very sick from COVID, flu, RSV, and some of these um, avoidable illnesses. So it's really important to get vaccinated if you're able to, especially if you have a chronic disease. COVID updates right now. 22% of New York City adults in New York City over 18 have received their updated COVID vaccine. The new COVID vaccines have been available, I guess, a couple of weeks. They're calling it the 2024 2025 COVID vaccine. 19% of children 6 months to 7 years have gotten the new COVID vaccine. And why this is a concern is that most people, the rate of people getting their booster, which would have been last year or 2023, end of 2023, the numbers were really low. So that means that most people probably haven't gotten vaccinated in 2 years, from what we can tell. And that's a concern because that means that people will have their immunity will have waned. They will be vulnerable again, and we don't want that to happen. This is not like a vaccine that you get in your childhood and you're covered for life. This is a virus that changes frequently as it moves from person to person. It mutates, it changes very rapidly. That's what we've learned about COVID. And just like the flu, you really need to get it. We're seeing that you really need to get it every year. So in defense of flu, COVID, and RSV, most people, I mentioned this before, most people who are at most risk of complications from flu, COVID, and RSV are people over 65, pregnant women, children under 5 years old, and people with chronic conditions. And COVID, flu, RSV shots prevent severe illness, hospitalization, death, especially among those with chronic conditions. RSV shots are also available for people, this should say 65 and over, pregnant women and infants under 6 months old, or children and adults with weakened immune systems. Does anybody have any questions about what RSV is, what the difference is?
Do you know what it stands for? I know it's respiratory something virus.
It it stands for respiratory syndrome virus, I think is what it stands for.
Yeah,
Um,
and I took it last year, and I was told I'm not allowed or not necessary to take it this year according to CDC
right.
guidance.
Yeah, RSV is really it's limited to older people who are 65 or older. I think 60 is um the youngest that you can get it, or if you have severe chronic illnesses, or very young children. And It's called respiratory syncytial. I was wrong. Respiratory syncytial virus, which I don't know if that really has any meaning to anybody, but
Except
that's
in
why
the
I think it's
medical.
easier to say RSV.
And
Um,
pregnant women, it says, can take it on the previous
preg
slide.
yes. Oh, yes. So I was just showing you, I have this slide here. So pregnant women between 32 to 36 weeks can take it, and then infants can receive it through in the form of an antibody. So that would be an injection, not a vaccine, but a injection of antibodies or blood cells. So yeah, so those are the 3 groups that are recommended to get it. So most people can't get the RSV vaccine. The general public can't. So that's why it's really important to be covered for flu and COVID, because you definitely don't want to get all 3 this season. We're seeing the rates go up, and we really don't want people to be infected.
Yeah, I had certain conditions, and that's why I was allowed to take RSV.
Oh, okay, I see. I see.
But it might have
Um,
changed. Maybe the guidance changed from 1 year to.
yeah, I don't know. It would depend on your circumstances. Um, yeah. I would have to look at that's a good point. I can check if people are interested and see for chronic illnesses what's covered, what chronic illnesses allow you to receive the RSV vaccine. I can look that up for you.
And it's really children and infants that are susceptible to RSV, as well as people over 65
Yes. Yes. Anybody,
and people
think
with
about it this
chronic health
way.
conditions.
Yes. Yeah. And it's usually something really severe, like you just had a kidney transplant or but I don't know, maybe the rules have changed. This is what I read a couple months ago, so I can double check and see if the standards policies have changed for CDC. Um and then we also have other vaccines that we can talk about, which include Tdap, pneumococcal, Hep B, and shingles. And depending on your age and risk factors, you might need to get these vaccines. And I'll talk a little bit about them later. So what do you do if you get COVID, flu, or RSV? Well, first of all, test. Testing is very important. You can get a flu, RSV, COVID test at Walgreens. You may have to ask for the flu and COVID test. I think, well, flu might be behind the counter. You might have to ask for it. COVID
Are they
and
nasal
RSV.
swab tests, or are they blood tests?
They're all nasal swab tests because they're respiratory. Yeah. Um, and some pharmacies and some clinics will offer you the flu RSV in it's one test. So it depends where you go. Um, that has been my experience. I think it's more common in clinics than like pharmacies. So
What do
follow
you
the
think?
recommendations.
What do you think of the free at-home tests that the government is offering for COVID?
They're fantastic. So thank you for bringing that up. So people can now apply online and get 4 free test kits sent to their homes. Um, I think my team has ordered them before. I don't know if I ordered them. My team has ordered them and they said it came right away, sometimes in a couple of days. And it was a good experience and it's convenient. Um, and the cost of testing kits are going down. It used to be like $35 for 2 tests. Now I think it's going down to 15. So it's getting a little bit cheaper to buy them, but it's very hard to find free testing kits anymore. So if the government is going to offer you 4 testing kits, I would order them. They come pretty quickly to arrive pretty quickly in the mail.
And also, when I was on the government website, it I had thrown out a bunch of tests because the date expired, but
Right,
they said that look at this list that has extended dates for expiration, but I had
right.
already thrown them out.
Oh
They say
yeah.
don't
So
use it
there's
if it.
Yeah, so there's a QR code on the side of the boxes. You can check the QR code And if you go to that QR code, it will take you to a website that will tell you if that vaccine is expired, if they extended the expiration date. I think in the past it usually was only like 6-month extension of expiration. So if you have something from 2023, it's probably not any good anymore, because it's almost the end of 2024. So that's my assumption. And there are a lot of expired kits, unfortunately. It's a shame. So again, if you end up with COVID or flu or RSV, follow the instructions in terms of what you're supposed to do. Follow your doctor's directions. Seek treatment. If you have the flu, you have about 48 hours to get Tamiflu vaccines. Sorry, Tamiflu treatment. So that's the treatment for flu. There's Tamiflu, Relenza, Rapivab, and there's another one called Zofluza. And those are the best ones for the flu, but you really have a very short window in which treatment will be useful. After that point, it won't really help you. So if you know that you have severe reactions to the flu, and you got tested and you tested positive for the flu, please get treatment as soon as possible. If you feel that you're going to get very sick. With COVID, I believe it's within 10 days, but the amount of time may have shrunk into 5, I think. So the first 5 days, don't wait. You don't want to be sick for 10 days anyway with COVID. So if you test right away, you should be able to get Paxlovid to take care of your symptoms, to treat your symptoms for COVID. And then RSV, there are some treatments for RSV, but they seem to be for people who should be taking the RSV vaccine anyway. Infants under 8 months can take a treatment called Nirsevimab. I'll just send you the list. And then there's another one called Abrevzo for adults over 60, and people for underlying health conditions can take another one called Palivizumab. They're tongue twisters, I apologize.
And those are treatments if you have RSV.
Treatments if you have RSV, if you fit certain criteria, like you're under 8 months old, you're over 60, or you have an underlying health condition.
Yeah, so your doctor would have to prescribe it and know that you have RSV.
The doctor would have to prescribe it, yes. And then, of course, if you have any kind of health condition like diabetes or heart disease, follow the normal illness, treatment, follow your treatment plan, and then follow any treatment plan your doctor normally gives you when you're sick, to make sure that your chronic conditions, symptoms do not worsen during illness. And of course, if you feel really terrible and things are not getting better, call your doctor.
When I had COVID and I had a fever, my doctor told me to stay hydrated and make sure that I consume electrolytes, because when you have a fever, it can deplete your electrolytes. Your body's working really hard.
Hydration is very important. Yes, and sleep. And keeping that fever down if you can. Okay, so I did want to tell you quickly, how are we doing on time? Quickly about some other vaccines that that people should try to stay up to date with if they can. Just out of curiosity, how many people are on the call? We have a few people, 3 people. Are there any people in
I see 9 so far.
9. Okay,
and
awesome.
Felix is here. Yeah.
And Felix, yes. Okay. So this is a list of the available types of vaccines that you can get for the different seasonal common illnesses that adults might get. So flu, I've named some of the ages that if you're 65 or older, you would get Fluzone, Flublok, Fluad. If you're 6 months or older, there's different vaccines that you can take for the flu. Flu mist is a nasal spray. It's really only for people 2 years old to 48 years, and pregnant women or anybody with any kind of severe medical condition should not take the nasal spray because it's live virus. So it's very effective in preventing the flu, but if you are, immune compromised, it could make you sick. So you want to take the inactive version of the flu vaccine. And I've named the RSV vaccines and COVID vaccines here are the ages that you should take it and for the different versions. Shingles is suggested for adults over 65 or people 19 years or older who are at increased risk of infection. And adults can get more than one dose, but you have to do it 4 to 6 months apart. Adults 65 and older, so they can get more than one dose of Shingrix each, to prevent illness. I would also say pneumococcal is another one for people 65 and older, children under 5, and adults and children with immune compromised illness. And this includes people for pneumococcal, heavy drinking and smoking, because it can lower your immune system. Because say you're developing, Hep C or something like that from the heavy drinking that can cause, can make you vulnerable. So
Some of these, it's not determined how many years in between. Like I took Shingrix and they said, we don't know, you don't have to take it now. We don't know when you have to take it again. Tdap, it says for adults every 10 years, and
every
then
10 years.
you have for children. Pneumonia, I don't know how often, and Hep B, I don't know how often.
So pneumococcal, I think you get pneumococcal every year because if you fit those categories, for older people, I think
I took all of these except the Hep in 2020 during the pandemic.
I'm not sure about pneumonia actually. The only one that I know that you have to take annually is flu, RSV, and COVID. The others, I'm not sure how often you have to take it.
No, RSV, they said I don't have to take it this year.
You don't have to take it this year. Yeah, it depends.
Because I took it last year.
Oh, because you took it last year? Huh. That's interesting. It's a new vaccine, so maybe they're still trying to figure out how often you have to take it. They just came out with the RSV vaccine last spring. So maybe it hasn't been officially a year yet, 12 months yet. So maybe that's why. So that makes sense. As for Tdap, yeah, I have to check about shingles.
And also they talk about
And pneumococcal.
most of these are before the COVID flu season, which, if you take it in, September or October, that's like the best time because you're going into winter.
Yeah, so I think for shingles and pneumococcal that would be true, right? That you should try to get it before you need to get your COVID flu because COVID flu usually, well, for flu at least, flu and RSV season is the winter, fall and winter. So, and usually people take those vaccines in October. The flu season is typically October through March. Um, and then for shingles and pneumococcal, you know, I think you can take that any time of the year if you're vulnerable, because pneumonia, it doesn't just happen in the winter. People get pneumonia in the summer too. Um, if they're, have low immune systems. But I think people typically take these things in the fall. So it might be good to do it before October.
Okay.
You
And
can
you
take,
said pneumonia was annual also? Because I think I
I
got it.
don't know. I don't know about
I
pneumonia.
got I got it in 2020. I haven't had one um since, but no
Yeah, I
one's
have to
been
check.
pressuring me to to take it. So I don't know if they forget to bring it or
I these are all good questions. I don't know the answer to them. Let me find out and then I can share that with you. Um,
yeah, I think the
I will
when
find
is good
out.
to know, like the how often is good.
Yeah. Yeah. Tdap I know is every 10 years for adults, especially uh because of tetanus, like people tend to like cut themselves or have an injury, and then you want to keep your tetanus up to date. And so they do all three at once. And that includes whooping cough and diphtheria, which are two respiratory illnesses. Um, and to be honest, most people think, oh, I have to get Tdap as a child. I don't have to get it again. You really do need to get it as an adult. And pregnant women also are asked to get the Tdap between 27 and 36 weeks very often. Same with Hep B.
In
Um,
the My parents in the 50s or the 40s, whatever, got something that left something on their arm for a lifetime. I think it was a measles vaccine. But when I was a kid, I got it and it didn't leave a permanent mark on my skin.
I don't know what causes that. I think that's the smallpox.
Oh, maybe they got the smallpox.
Yeah, I think that's it leaves a distinct mark on that kind of sticks up. I think that's the smallpox vaccine that does that. And we don't have to take that vaccine anymore because there aren't it isn't it's been pretty much eradicated, I believe. So in the US. So we haven't had to take that vaccine. Um yeah, but I think it was smallpox. um okay. So does anybody have so Hep B. So Hep B vaccines, all people need to get the Hep B vaccine. All children under 19 must get their Hep B series, which is a 5-dose series. If you're at high risk of infection, so if you work in a healthcare setting, you have diabetes, you visit a country that has high incidence of Hep B, you have a history of STDs or Hep B infection or drug use, it's recommended that you get your Hep B dose again. I think most adults get at least one dose of Hep B as when they're 19 and over.
That's interesting you bring up traveling because
Hmm.
if you travel, you could probably go on the I forgot what the name of the government website is, but it's you can find out what to be vaccinated for if you go to a particular country.
Yeah, I think that's World Health Organization offers travel advisories. Um,
And I think in the United States, it might be the Department of State, the ones
yeah,
that
you're right.
issue the pass.
Department of State, but also, yeah, Department of State offers travel advisories. Yeah, what vaccines you need and that sort of thing. And safety advisories. Yeah. Okay. So we have the tools to fight seasonal illnesses. Um, you know, Vaccines, masking, if you're infected, testing. These are all really, really important. And I did want to let me stop sharing, um, share a couple of other pointers. I can pull it up. Does anyone have any questions so far?
If anyone has questions, feel free to type them in the chat. One person asked where you can order the free COVID tests, and I put that. It's covidtests.gov.
Yes.
But yeah, feel free to type questions in the chat. I think also there are people that are against the anti-vaxxers that think that you can develop a natural immunity to COVID and things of that nature, or they're just tired
Sure.
of getting the shots.
Yeah, I can
And
talk about natural
yeah,
immunity if you want.
yeah.
Hold on a second.
I mean, I had COVID this year, but I'm still getting the COVID vaccine. My doctor told me it's okay to get it. Some people get symptoms after they take the COVID vaccine. Some are fine. I'm usually fine afterwards. It just depends on the person, but I think it's better to deal with the symptoms of not having COVID, but being vaccinated than having COVID. That's just my
So
personal opinion.
yeah, and this is the thing about talking about COVID, and vaccines in general that we've learned. Um, and I was going to get into that, but first let me end that basically, a big part of it is using a culturally responsive approach, an approach that is um driven by trauma informed care, right? Approaches. So I'm going to talk about that in a second. Um, but I do want to answer your immunity, natural immunity versus vaccine immunity. So natural immunity, I'm going to show this on the screen. Natural immunity can lead to, in some cases, can lead to lifelong, long-lasting immunity. But um, there's no, it takes time for your body to produce those cells. So you can get sick multiple times while you're building that immunity, right? Um, so, people often say, "Oh, well, I had chicken pox and now I'm immune to chicken pox," right? But so I'm just going to do the same thing, I'll just get infected. People during COVID were having these parties where they were like trying to get infected so they would be immune. The problem is that depending on your health, you could get very sick in the process, right? And is it worth that risk, right? So some people get chickenpox, which for a lot of people is not they get it and they recover and they're fine. Some people could end up with pneumonia. They can get very, very sick from chickenpox. So it depends on your body and how your body reacts to that virus. And everybody is different. So, one sister could be fine and the brother could have a severe reaction to the same virus in the same family. So you really don't know. And scientists have looked at and studied how the vaccines react in the body. So we know what to expect. We know the side effects, and we know how to control it because they've been studied in labs. So we know with people have participated in these studies. So we know how the body will react, how people of different health conditions will react to the vaccine. Um, you know, it's an experiment if you do it on your own without the support of medicine. It's taking a big risk. So that's just something to think about. And then the other thing is about natural immunity. We don't really know how long it lasts with COVID, right? Some people, our understanding is that it probably lasts about a few months. That's our understanding. So when people in the past have gotten COVID, they've been encouraged to get the vaccine or update their vaccine after a few months, because our feeling is that's when your immunity will have waned, and you will need it. So just that's just something to think about. And right, and this is some more information about that. We know that in most cases, the reaction to the vaccines are mild, and we know how long somebody will have side effects. Whereas if you do natural immunity, we don't know how long you will be infected. We don't know how sick you will get if you decide to deliberately infect yourself. So it's a safer way to build protection,
Yeah.
is
And I
what we're
mean,
telling people.
I know some people that have been vaccinated for COVID still get COVID, but the symptoms are less severe and it lasts for a shorter time. I took it 11 months ago. I'm like a life example. And plus the Paxlovid treatment really cuts COVID-19 off at the knee.
Right. And what I would say about COVID also is, that, when we're talking about, we're not promising that you're not going to get COVID at all. It's the virus is changing so rapidly and so often that we can't promise that. What we can promise is that your chances of being hospitalized and severely ill or dying from COVID will be seriously lowered. That is the promise that we're able to make. And to be honest, there are no vaccines that out there that promise 100% immunity. It's not possible, because that's how viruses work. They're always changing and always growing. So I just wanted to talk quickly. Are there any questions? I'm surprised this group doesn't have not a single question.
So far, so quiet.
Wow.
Does
Okay, and jump in. Don't be shy.
Yeah, I think about your own situation. Do you have any questions about, anything that's going on for you?
You want to hear? I can also talk about. I didn't talk about long COVID. Um, does anybody want to hear about long COVID? I kind of skipped over that. Um, but I can talk
What's
about that.
after long COVID? Because why don't we just ask in the chat? Put if you want to hear about long COVID, yes or no, please. If not, we could go to the next topic. If there's no response, then we assume it's a yes. Okay, if there's no response, it's a yes. Go talk about long COVID.
Okay. All right, let me just. So, let me open it up. Sorry. I am so sorry. I thought I had it opened. I don't see it.
I know a few people that have had long COVID. One person had lost her sense of smell, and her family noticed the smell of gas in the kitchen, and she did not.
Well,
And so if her
that's
family wasn't
actually,
there, you
yeah.
know, who
Well,
knows what would
actually,
happen.
that's a symptom of COVID. That's long COVID and COVID are different. So hold on a second.
She had it well after she had COVID. And she had a bad case.
Okay, here we go. So I'll tell you a little bit about long COVID. So long COVID is an infection associated with COVID that presents for 3 months or more. And we're seeing a lot of cases, 1 in 5 people who've had COVID, 18 to 64, experience symptoms of long COVID. And the way it works is, you may have severe case of COVID, you may be asymptomatic. You can still end up with long COVID, which includes fatigue, chest pain, shortness of breath, cough and sputum production, muscle weakness, sleep difficulties, anxiety, depression. Um, and it usually occurs more than 4 weeks after the symptoms heal. People at most risk for long COVID are people with diabetes, elderly chronic conditions, people with low immune systems, such as asthma, connective tissue disorders. Women, for some reason, are more vulnerable to getting long COVID.
Is there a
And
slide? Because your slides are.
oh, you can't see my slides? I'm so sorry.
No.
Okay. I thought I was sharing them. Okay, there we go. So, and there's something called a reactivation of viruses, which means that basically you get the symptoms of COVID again, in your body. That happens sometimes. And it's pretty severe. Long COVID symptoms can cause a 30% drop in lung function, acute respiratory distress, which means you have trouble breathing, lung damage, exhaustion, headaches, dizziness, mood disorders, heart health effects such as myocarditis, high blood pressure, fast beating heart, blood clots. So all these things are symptoms of long COVID. What the 3 types of long COVID physicians typically see are ongoing COVID symptoms such as brain fog, coughing, and headaches related to chronic hospitalization, problems such as health problems such as muscle weakness, cognitive brain dysfunction, or mental health, psychological distress from being in the hospital for a long time. And then other people have a range of symptoms that depends on how their body reacted to long COVID. There's many, long COVID doesn't really have one test. Based on how you are screened and what you say are your symptoms will be what tests they decide to give you. These are kind of an array of the tests that Mount Sinai has explained that they do when people are experiencing long COVID. So they kind of do a pre-screening, then they do the testing, and then they determine treatment. And there are Mount Sinai, Bronx, I think it's Bronx, Lebanon. Here it is. Okay. So Mount Sinai, HHC, Bronx Care, and Montefiore all offer long COVID services, but only some offer for uninsured, and that's HHC and Bronx Care. Just so you're aware. And I have some connections to Mount Sinai if you're interested in Mount Sinai for long COVID care. Any questions about long COVID? No?
So there's no specific treatment for it?
It depends on your symptoms because there's a range of symptoms for people. So it really, it's very difficult to diagnose, and that's why there's now specialists that just focus on long COVID because they've been doing research, they've been seeing patients, and these specific health centers have been focused on that in New York City.
Yeah, as a patient, or knowing some patients, they know that they have symptoms. So it's not that they're expecting to be diagnosed. It's like, I go to the doctor because I'm always exhausted, or I can't, or I have trouble breathing. Those are my symptoms. It's like, I don't need you to diagnose me with long COVID because I have it. This is what I have.
Right. Yeah, it can be really frustrating for people, because, you know, it they don't know if it's because of something else. They don't know if it's because of a chronic illness, getting older. Some people, are not sure, may have never had a chronic illness and all of a sudden it appears. And then they're not sure how to explain it. And they don't know if it's because they've been less active during COVID, or getting older, or something else. It's so the only way to know is to go and get screened, for sure. And it's better to be safe than sorry, right? And make sure that you're okay. Some people avoided, doing their regular doctor visits during COVID. And so even though they're not sick with COVID and not having long COVID, maybe they didn't get treatment for something that was starting to develop, while they were kind of sequestered at home. So there's a lot of reasons, and everybody's different. Every human being, their body is different. So the only way is to talk to a doctor, and to give them as much information you can. Like there's a great uh, medical history, or COVID history guide that HHC provides that I can send to you, where you write down, well, when was your first case of COVID? Did you have any second? What were the symptoms? So you can kind of catalog and advocate for yourself about what exactly happened to you and to your body, so you can share that with the doctor. And that's the best way you can help yourself get the treatment that you need, and get the right answers. So I'm happy to share that. They have a lovely long post-COVID guide that they've created for patients. I can send that to you. So, but the most important thing is, and I wanted to talk about this, because we can all be advocates for not just ourselves, but for other people. Say we've gotten our vaccines, our adult vaccines, and we know somebody who's really just not interested in doing it, has read a lot, has heard a lot from people, and they just are against getting the COVID vaccine, getting flu vaccine, any vaccines. We're seeing kind of a pushback from people about vaccines in general lately. And what you can do is come from a place of curiosity, right? And trying to understand that person. So say this is a family member, come from a place of curiosity about, well, why do you feel that way? Explain to me, and learn about that person, and try to understand their fears and their concerns, right? And show compassion. If we come from a place of like, oh, well, I know everything and you're wrong, then nothing is going to change, right? Nothing is going to change in that person's behavior. Also, come from a place of compassion about any trauma they may have experienced. A lot of what happened during COVID was that for many people, the doors were not open when they wanted to get tested. The person didn't have documentation. Maybe they were here, they were undocumented or an asylum seeker. They didn't have the right paperwork, or they were afraid to show any identification in a healthcare center, so they didn't get tested. Or maybe they went and they were rejected. We heard stories from people that they went to healthcare centers and it was traumatic, because they went all the way there just to be told, you don't have the right paperwork, or you don't have the right qualifications to come in here and get tested. And that was hurtful and frustrating to a lot of people. And I think that was happening because they were trying to limit how many people went into the hospital that were healthy or potentially healthy to avoid further spread of disease, right? But it didn't help. It didn't help people. A lot of people didn't want to go back to the hospital after that. So, come from a place of understanding that not everybody has positive experiences with the healthcare system, and a place of curiosity and understanding, and leading by listening, leading by asking questions, and and also asking the person if they want to hear what you have to say, not just volunteering it. So these are kind of the things that I tell people when it comes to how to talk to somebody about vaccines. First of all, find out if they even want to know, right? If they don't want to know, they don't want to know. If they're not interested, they're not interested. Pushing your agenda or your thoughts on somebody doesn't work. We've found that again and again. And if they're open to it, great. Uh, what we do find is that it when you talk to somebody about, say they give you a myth, they talk about a myth, a common myth or misconception about COVID, about vaccines. Oh, well, it's much easier and safer to get natural immunity. We'll say, okay, I know you've heard that natural immunity is a safer bet. You kind of create this like myth sandwich where you start with the myth, you follow up with a fact, and then but you kind of create this idea of like, I'm listening to what you're saying, I'm repeating it back, but I'm showing you like the facts that are actually, if you think about it, make a lot more sense, and they're a lot more based in science and reliable sources. But you create it and you say it in a way that you're repeating back what they're saying, so it sounds like it's in their own voice. And that seems to work really well, and that's comes from motivational interviewing approaches that my team has learned. And understanding that not everybody's going to be interested in what you have to say, not everybody's going to be willing to hear. Sharing stories. So my team shares a lot of stories about other people they've talked to. When people say, I don't know, I'm not sure, well, then we tell stories. We tell stories about people who have changed their mind and why they changed their mind. Instead of saying, well, this is what I think, we tell them, well, here's what somebody like Felix often tells a story about a mother and two daughters that, she had two daughters and she was scared to get her daughters vaccinated, and he convinced the daughters to vaccinate. They were really worried about their fertility. And, it comes down to, and in Felix's case, I think Felix, you kind of took an approach of like understanding the culture and understanding, and you can talk to that, I think. Do you want to tell that story?
Hi, my name is Felix Rojas. I'm a community health worker, a health advocate as well, working with doing this, I guess, for model law for my community, my Hispanic community in general, actually. Yes, I mean, I encounter so many things, and I'm coming from a Hispanic background. I can put myself in their shoes, and there will come tons of questions. Yeah, remember with that craziness that I call that happens, and because we Latinos, we think and believe in having a big family. So I had to, put my hat and explain them that you want to have a beautiful, happy, healthy family. You're young enough, because these girls, they were bound to college already, about to go to college, but then pandemic happens, and the mother she was worried about like, I like the grandkids and so many things that we're hearing. So, but I had the chance to talk to them girls like if they were my nieces, and I sat down with them and I explained them, and then I get acquainted with them. I spoke to them like family, because that's how you have to approach them, like family, like because you could be my niece or my daughter. So we had that approach, and then after I say a long conversation, they felt comfortable. They felt comfortable that time. That happened like 2 years ago, and they got not only the dose but all the doses. And then after that, And one thing that I did, it was just like giving my business card on my so he can call me so follow up. So we had like a relationship, you know, up to now, hoping they almost finish in college at the last time I spoke to them. So like I said, it's family approach that we need to see. Like, everything's gonna be fine. We own this together. It doesn't matter about religion or race or color or height or you know economics and all that. We have to people have to look out and take care of each other. And last but not least, I like to like I introduce myself. I'm a community health worker. Um, uh, Before Moria, just 2 minutes to um being working with the immigrants. I started like I said, the institute that was 7 years ago. And one of the things that I am so proud of uh, the service that we provide is the health insurance for those who doesn't have. At the Institute for Family Health, I got a fire here. We have over 18 clinics all around Brooklyn, Manhattan, Bronx, Mid Hudson Valley. And in the service that we provide in our clinics is primary care, prenatal care and pediatrics, women's health, care for diabetes, HIV, and other chronic diseases, illnesses, mental health services, social work services, dental care. There's a plethora of service that we service for free. Why? Because we're federally funded. And the good thing is we have a network of over 18 churches, like Catholic churches, African American churches. We got a Pentecostal, we're Adventist. I mean, it's actually it's a great thing. Like we all get together in this sense of getting help, and we actually have a coalition of almost 15 mosques and masjids that we offer free services, like free health insurance, like primary health services. And then we got a great relationship with them, not only with mosques, with churches, with Catholic churches, evangelicals, like I say, all type of a walk of life. They come to us asking for free health insurance, especially those brothers that are coming over the border. Me as an Hispanic, I've been here in this beautiful country for almost 40 years. Over 40 years, I went through all that, to myself assimilate to a system that is not mine. So all these services, we help them to navigate the system. Sometimes it's kind of hard for them because of the either a language barrier or they have to get accustomed to the system. So far in the over 18 clinics that we have, we surveyed over 1,200 people already, way over 200 people already. They're getting the health insurance and the service through the institute. It doesn't only stop there. We offer mental health services as well. We offer services of like we give like nutrition outreach. We do pantries. We do wherever they call us. Wherever they call us, we got a whole team there. Like our team is 5, 6 people that we go there. We table. We only give we give PPEs. A COVID test when we have it, because sometimes we get provided by the DOH. They allowed us like a lot of boxes for COVID tests and masks and whatnot. I think we supply over 2 million masks already. I'm over probably 2 million of COVID tests so far, and the response is great because you get to these brothers and sisters. When you get to them and you speak the language and whatnot, and then you get acquaintance with them, and then you follow after that. So I'm so proud of being part of the Institute for Family Health. Like I said, my name is Felix Rojas. I'm a health advocate. I'm a community health worker. We've been in the trenches since the COVID happens, and we're still working, for the work of our community.